When it comes to libido, there's a lot of noise out there. Today, we're setting the record straight by breaking down 5 of the most common myths we hear at Rejuvime. Myth number 1, low libido is just a part of getting older. But the truth is, aging can affect hormones, but that doesn't mean desire has to disappear. With the right support, libido can thrive at any age. We've worked with patients in their 30s, 50s, and even 70s that saw dramatic improvements in libido. It's not about age, it's about hormone balance and overall health. Myth number 2, if you love your partner, you should always be in the mood. But the truth really is, desire is impacted by hormones, stress, and health, not just attraction. This particular myth can cause guilt in a lot of people when really, the issue may be physiological. Myth number 3, low libido is only a problem for men. Not true. Women experience libido shifts just as often during perimenopause, postpartum, and stress-heavy seasons. Myth number 4, pills like Viagra fix everything. The real truth is, ED meds help with function, not desire. Libido starts in the brain and is deeply tied to hormonal balance. These medications improve blood flow, but they do not increase interest or emote connection. If your body isn't producing the right hormones, no pill can create desire from scratch, which is why many people feel disappointed when the quick fix doesn't work. Myth number 5, if your labs are normal, your libido should be fine. Not true. We look at the optimal levels, not just the normal ones, and there's a big difference. And that's where the real answers live. We focus on what helps you feel energized, connected, and at your best, not just what looks okay on paper. If you believed any of these myths, you're not alone. Let's cut through the confusion and find out what really works for you. Book a consultation with Rejuvime today. Whether it's hormones, stress, or something else, at Rejuvime, we're here to help you find that root cause and feel like yourself again.